CBT. How to overcome depression and anxiety and develop positive thinking and self-esteem. Written by Philip Morra. Narrated by Josh Fisher and Scott Sandler.
Introduction. Cognitive behavioral therapy, or CBT, is a commonly prescribed type of psychotherapy that can be extremely helpful in dealing with a broad range of issues in a way that creates more positive outcomes for your life. These issues can range from post-traumatic stress disorder, PTSD, depression from the loss of a loved one, from death or divorce, changes in your career, or from physical or mental illness. It can be used on its own or in conjunction with medications to treat mental illness. Cognitive behavioral therapy can help a person to learn ways to identify and manage their own emotions, as well as how to navigate challenges in relationships with others. Some with significant emotional trauma as a result of abuse or exposure to, or participation in violence, can benefit from the CBT process. It can also help people with more serious mental illnesses, including bipolar disorder and schizophrenia. The risks involved with CBT are few and generally temporary. It can be stressful to identify and confront issues of anxiety, so it is not uncommon to feel pressure and tension during sessions that are especially challenging, so the patient may feel emotional pain and even cry during those times. Finding the right therapist for you is crucial. This means someone you can connect to on a personal level who specializes in the type of emotional disorder. On average, most need anywhere from 5 to 20 sessions, which may be one-on-one or in group situations. It's important to approach your therapy as a partnership. Be open and honest about how you are feeling and your behaviors, because this helps your therapist help you. Adhere to the plan you decide upon with your therapist. You can't expect instant gratification with respect to results, so be patient. Over time, you should see improvement, which translates to an improved quality of life. Chapter 1. Principles of Cognitive Behavioral Therapy. Based on a cognitive model that comes from emotional responses. 1. Brief and time-limited. 2. Therapeutic relationships with a sound foundation are necessary for the best therapy. 3. Based on an effort that is collaborative between patients and therapists. 4. Based on the aspect of Stoic philosophy. 5. Utilizes the Socratic method. 6. Is directive and structured in nature. 7. Based on the educational models and findings. 8. The theory of CBT relies on the inductive method. Cognitive behavioral therapy is not a distinct therapeutic technique. In fact, CBT is a generalized term for a larger classification of therapies and the similarities they have. There are multiple approaches to CBT, such as dialectic behavioral therapy, cognitive therapy, rational living therapy, rational behavior therapy, emotive behavior therapy. The foundation of CBT is based on the cognitive portions of emotional responses. This type of therapy stands strong on the foundational fact that our thoughts are what cause us to feel and act in certain ways, not just external things such as events and people. The best thing about this is that we can change the way we think, feel and act, even if a situation we are living through will never change. CBT is time-limited and a briefer therapy. CBT is one of the most rapid forms of therapy in existence today, unlike other forms of therapy such as psychoanalysis, which can take years. CBT is briefer thanks to its highly instructive nature, and that it makes use of people's homework assignments that therapists give them. It is very limited on time, which helps patients to better understand from
Sample complete. Ready to continue?